less flow, greater filtration, relatively more proteins reach here, because filtration increased here, more substances went out, so concentration of protein is increased. What would happen to the pressure here, oncotic pressure? The pull back will increase. Why? Because the concentration of proteins have increased. What would that mean? That would mean the reabsorption would increase. That would mean reabsorption. So you say, man, why did we have to filter more only to reabsorb more? Well, it's a very simple thing. Kidney is a clever system. What it is doing is, it is filtering out everything, then deciding that, hey, I did not want to throw everything out, I really need these things, so it is pulling them back, but in that process the waste products are not pulled back. So the blood is still cleaned, the plasma is still cleaned, but plasma is not wasted. And when would a person have a low flow? When a person is in a low volume state or low pressure states. Hemorrhaging person, sweating person, diarrhea, in those cases the flow is going to reduce here. Flow reduced, should we say, alright fine, this guy has a reduced flow, now we should not filter out the substances? No, we should keep the substances getting filtered correctly. But think about it, doctors, but should the extra filtered substances be wasted? No, the person already has less volume, he already or she already is suffering with loss of substances. That might be water, sodium, chloride, all of those things. Now you're filtering them more as well. If you did not reabsorb them, then the person is going to go in further low volume state. So clever system here, pushes things out, pulls them back in. What did it achieve? It achieved the clearance. It achieved the filtration of the waste products which are not pulled back. So even in a low volume state, person's kidney would keep functioning normally and keep cleaning the blood, plasma. This is a very important concept, and these two players work together to make this happen. Not one of them can do it alone. Okay, now how about the pressure system? Pressure system in this whole system can be controlled by, from here, afferent arteriole or efferent arteriole. Let's talk about this one first. If the efferent arteriolar diameter reduces, that will mean pressure here will increase, pressure here will reduce. Now think about it. Increased pressure here will mean what? It's a hydrostatic pressure. It is not oncotic pressure increase. Why? Because proteins are still the same size, same number. So oncotic pressure is the same. It is the hydrostatic pressure which has increased. That would increase the filtration. On the other hand, again here the pressure has reduced. Again, oncotic pressure, no, it is still the same. Of course, due to the concentration there is a relatively greater oncotic pressure here, but hydrostatic pressure has reduced, and that once again would cause the reabsorptions to occur. Right? So you can actually increase the GFR, glomerular filtration rate, and we'll talk about it later. That is the rate of filtration in a unit time, right? Filtration in a unit time. So rate GFR would increase under pressure, and if the flow is increased as reduced, then the filtration would increase. So now two concepts to know: glomerular filtration and filtration fraction. Glomerular filtration is when the substances come into this space. I'm going to take this one out. Glomerular filtration is the substances which are in the glomerulus how much of those are moved out into the Bowman space. That is glomerular filtration. When you put rate on it, when you say within the time frame, then that becomes GFR. Filtration fraction is, for example, for a substance, what is the amount of substance filtered? I use stars for the protein, so I'm going to use dots here. So 1, 2, 3, 4, 5 and 10, and if there are 5, then 50% of the substance got filtered. So if let's say 5 came in here out of 10, so 5 are here and 5 are here, how much fraction got filtered? 5 or 50%. So that is a filtration fraction. Normally filtration fraction is about 20%. So 20% of a substance which comes in here gets filtered into the Bowman space. So if 100 comes in here, 20 goes in here normally. So we'll talk about the variations in that. Filtration fraction, so now this is a USMLE worthy concept. Filtration fraction is affected by the flow. Slower the flow, more the filtration fraction. Faster the flow, lesser the filtration fraction. Don't forget that. Glomerular filtration is pressure dependent. So the factor which affects glomerular filtration is pressure. The factor which affects filtration fraction is flow. So whenever there is efferent or afferent arteriolar diameter change, that would change the glomerular filtration. So we'll talk about it in a second, that what do these things mean. Let's go to the next one. Okay, so before we talk about the materials filtered, let's do a little table here and say, let's say we have let's say afferent arteriolar, let's say we have filtration fraction, we have glomerular filtration. What would happen if I constrict normal, everything is fine, filtration fraction GFR, they have a particular value. If I constrict the afferent arteriolar constriction, what would that do? Afferent arteriolar constriction, so this one, so afferent arteriole is here, efferent is here, glomerulus is here, peritubular capillaries are here. So this one is constricted. What will happen? Pressure in the whole system here will reduce. So GFR is pressure dependent, so this will go down. What will happen to the flow? Flow will reduce, so filtration fraction in the low flow will increase, correct? What would happen at the peritubular capillaries? So when the GFR is reduced but the flow is increased, so filtration is increasing, the relative amount of proteins might stay stable, so not much change here. Efferent arteriolar constriction, this guy, so this guy is normal now, this guy is constricted, pressure increased here. What is pressure dependent? Glomerular filtration, so glomerular filtration increase, flow reduces here. What is filtration fraction dependent? Flow, so that would increase, right? We will talk about this as well, that there is a ratio between these two and what happens to that ratio, but remember this first. Okay, so now let's continue. What materials are filtered? So of course we have materials which are being filtered. What is the reason for materials filtering or not? What are the factors? It is the negativity of the membrane of the glomeruli, the basement membrane. That is what defines what is being filtered. So because it is negative membrane, proteins or negative substances find it difficult to be filtered. Neutral substances find it easier, and positive substances find it very easy. So from the filtrations membranes, and I have a rudimentary lecture which I gave about 2 years back about this thing, and it was a paper and a pen and a shaky camera. Look at that in YouTube. But what happens is the basement membrane for filtration is negative. If there is a substance which is positive, it would be attracted to it fast and it would be filtered fast. If substance is neutral, it would go in with slightly lesser speed and attraction than positive, and if it is negative then it is not going to come